Now, I'm Tamanna Inamdar. Pandemic policy is also economic policy. This excerpt from a note from the IMF recently, which lays out a plan on how to put an end to COVID-19, is a crucial standout because it talks about how governments, policymakers the world over need to laser focus right now on bringing an end to the COVID-19 pandemic. That is the only way to end the health crisis and the economic crisis, which is tied so closely together. We're having this conversation today at a time when the worst of COVID-19 cases in the second wave could possibly be behind us. We've come down from 4 lakh cases every day to below 3 lakh cases, at least for the last 6 days as our daily COVID count. But truly is the worst behind us? What can we expect going further? How is our medical infrastructure coping up? To speak on all of this and more, I'm joined now by Dr. Sangita Reddy. She's the Joint MD of the Apollo Hospitals Group. Dr. Reddy, thank you so much for speaking with us here at ET Now. Let me start by getting your comments on the numbers. Now, the Health Ministry has said that there is a progressive fall in cases. 531 districts had over 100 cases 2 weeks back. It's now down to 481. 382 districts in the country have cases which are showing less than 10% positivity. Can we heave a sigh of relief, or are there concerns that these numbers may not be truly reflective of what is happening in rural India outside the large cities?
So first, hello Tamanna, and good to see you and be on your show. I have, over the last 2 weeks or 3 weeks, just not been able to do anything else but just spend time in the hospital or work with patients because the numbers were just so unbelievable and the pressures were so incredible. But we are so relieved as healthcare professionals to see the numbers come down, and yesterday's number at 2.59 lakhs, down from the high of over 4 lakhs around May 6th, has really been a tremendous and significant factor. Also, to add to that is that, the numbers have been below 3 lakhs for the last 6 days. The positivity rate across the country is about 12.4%. And this is, while we are doing about 20 lakh tests per day. So it's not as if there's under testing. So I would say that we're definitely seeing a better scenario than we were in about 2 weeks ago. And we must just hope that this trend continues, this reduction continues. I will call out, you rightly observed that Delhi is now at a positivity rate of only 4%. I will call out the fact that hospitals are still under pressure for their ICU beds because patients who, have fallen sick over the last 10 days are still going to need intensive care. The average kind of stay for a critical patient is 14, 15 days. So the hospitals are still under pressure, but the waiting lists are not the way they were 2 weeks ago. And this is a great time to really thank all healthcare professionals, but also to call out the fact that states like, cities like Kolkata, Bangalore, Guwahati, Chennai, the states of Tamil Nadu, Bhubaneswar are all still in significant distress, and we just hope that they will soon also see the number of cases falling. So that's a quick wrap up of how we are seeing from the ground in hospitals, how we are seeing things. The important factor that you called out was the districts or the smaller towns. And all of us know that more than 60% of our healthcare facilities, both government and private, are really in the large cities or the top 30 large cities. So we are worried about district headquarters and villages because it's not only the positivity rate, it is also the fact that they would not have healthcare facilities. And I'm glad to see that everybody, government, private, NGOs, everybody is trying to ramp up isolation centers. We've done an isolation center in Aragonda, in Chittoor, where we're partnering with PSUs to do isolation centers in the outskirts of Guwahati, in Dibrugarh, in various parts of Northeast. So it's important for us now to send supplies, medicines, oxygen concentrators into the smaller towns to keep them ready for what is going to be coming or what is already happening in their areas.
Let me get a bit of detail from you, Dr. Reddy, on when you describe the situation in hospitals, because that in a sense is a true gauge of whether we have come off the peak. So even a month ago, we were in a situation where hospitals across the board just could not accommodate the patients coming to them, whether in ICU or, for regular COVID care. They were running out of oxygen, running out of supplies, and those stories were coming out. Can you see a marked difference right now? And what is the situation right now in terms of challenges?
So clearly there's a tremendous difference, Tamanna. I mean, the fact is that you're absolutely right. 2 weeks ago, we were just desperately looking for beds. We were adding capacity, we were buying ventilators, we're continuing to do that, of course, but it was the waiting list in every one of our hospitals was upward of 50, 60 patients waiting for a bed. Sometimes, on some days we had over 120 people waiting for a bed. We were helping to reallocate them. We had created a structure of home care, of telemedicine, of hotels converted. We were partnering with other nursing homes because it's horrible to say we don't have a bed. We were trying to find ways for them to go into other facilities. That pressure has definitely reduced. And then you spoke about the important aspect of oxygen. So clearly the country saw a 5-7-fold increase in the requirement of medical oxygen, but the world has been kind. Oxygen concentrators have been flown in from everywhere. Industry has been participative, and medical grade manufacturing of oxygen has completely shifted industrial grade has shifted to medical. I think the infrastructure, the logistics, whether it was oxygen tankers are being taken on trains, empty tankers flown on planes, everybody just moved in and said, let's find a way to keep people alive and keep people, give oxygen. And I think this has been a tremendous humanitarian, public service, government, a global unified effort. And it's very important for us to acknowledge that behind each one of these are logistics nightmares, are stories of people, who have suffered, but also people who have stood up and said, let me go beyond my call of duty. And I really want to gratefully acknowledge many, many corporates who have given us oxygen concentrators, the French embassy who gave PSA units, MEIL who gave us cylinders. There are hundreds of, the Jindal group. I can't even name the number of people. And I know that this kind of help has happened all over the country. And we are truly grateful. And I think patients are grateful to know that everybody is of the spirit that we're all in this together. And that is a very powerful sentiment. I also want to add one fact, that even in the darkest moment, the healthcare teams, doctors and nurses were stretched, but they stood up. The Indian healthcare system did not break down. And this is a point to be, justifiably, as an Indian, I really, want Indians to be proud. Yes, there have been areas where, and there have been sad stories of people who were denied care, who didn't get enough. Everyone has lost a loved one, and I cannot but empathize and, feel really bad about this. But I would also like for people to acknowledge the fact that healthcare workers have done their real best. Nobody abandoned duty. People stayed at the work site for days on end. Nobody looked at, am I seeing my child or not? And for this, I also want to call out, I think the Government of India policy and their ability to vaccinate healthcare workers made a huge difference. And we do have the sad loss of lives of doctors. But I do want to say that by and large, the infection rate as well as the severe morbidity rate and mortality rate in healthcare workers has been significantly low. And this has been facilitated by the fact that many, many of them were vaccinated. So, as the country comes back, we still a few weeks away from having really overcome. But as we come back, we need to continue to keep the energy and keep the spirits. And that's why I keep on acknowledging the healthcare workers. We have, more than a month left till we see things really being much better. And therefore, we must continue to encourage our healthcare workers and thank them and stay positive, not in terms of your RT-PCR test result, but stay mentally positive.
Even as completely, I echo your sentiments when it comes to healthcare workers. I must ask you, Dr. Reddy, about the new fear and new concern of mycormycosis or black fungus. Over the last 3 days, this has been causing a lot of worry, concern. It has now been declared and notified under the Epidemic Act in quite a few states. What are you seeing on ground? Why this sudden surge? Because it is being also put down to an overprescription of steroids and the kind of treatment which was being given for COVID-19.
So clearly, mucormycosis has become a significant problem in several parts of the country. And while mucormycosis is a rare and, it's a well-described condition, in this wave, the large number of these cases are being identified. And like you said, this is probably because of the excessive use of steroids for a prolonged period of time, especially in those with diabetes, and this results in high sugar levels. Also, there's the condition of metabolic acidosis, which promotes the growth of this fungus. And in patients with COVID-19, there is also an excessive ferritin. And ferritin is also something which promotes the growth of the fungus. So multifactorial things are leading to this, and the availability of amphotericin B, which was normally, quite easily available, it's become a challenge now, and therefore it is, very difficult to source the drug. It's being controlled by the government, but I'm told that manufacturers are stepping up the production, and I hope we get over this soon. I would just, reiterate that it's very important to adhere to treatment protocols. And self-medication, especially on steroids, must be discouraged. Doctors are available on telemedicine. Please reach out. Many are doing free teleconsults, as are we, and therefore, please follow a protocol. Indiscriminate use of steroids is not recommended at all.
I want to talk to you about vaccinations, Dr. Reddy, and I was going through the IMF note earlier. They project that at the current rate, and it's a business as usual projection, India would have vaccinated 35% of its population by the end of 2021. This is with one dose. The worst case scenario they paint where, developed countries start aggressively vaccinating children and then going for booster shots leaves us with even lesser coverage. What is the current situation? Because you're one of the few private hospital groups who've managed to be able to start a vaccination program and tie up with vaccine makers. Has the visibility on doses improved since we started 18 to 44 vaccinations? Is there a clarity on how many doses will come, and can this be expanded?
So clearly, we have been very committed to acquiring vaccines and rolling out vaccines, as are many others. But clearly, vaccination is the single most important methodology for us to overcome this pandemic. And therefore, all of us must work together towards ensuring that a significant percentage of our population is vaccinated. I think the numerous initiatives which have been taken, whether it's opening up of enablement of import, enhancing the production of vaccines, advances given to vaccine product manufacturers, I am fairly confident, or I'm optimistic, let me say, that the country will reach this level of vaccinating 5 million Indians a day, at least in the next 30 to 45 days. That should be our target. We have been given to understand, and we've, really collated publicly available information. And I understand that there are about 13 crore doses will be available by the end of July. And by the end of the year, we will have almost 2 billion doses. And it's important for public and private to work together. I continue to hope and request in whichever way we can that international vaccines also come into the country in large numbers, because it is not just vaccinating, but vaccinating at speed and scale before we give the virus a chance to mutate again. And that is where, the significant planning, coordination of all of us coming together to vaccinate as many as we can in the shortest possible period of time. I think that hopefully by the end of the year, there will be 2 billion doses of the vaccine. But if by November, we can have at least one dose to 60% of the population, this will be a significant target that I think all of us should aspire to together. And on behalf of Apollo, I just commit that we will do our utmost and whatever we can in corporate, in communities who cannot afford it, to our routine patients and customers who walk into our hospitals and our clinics across the country. We will really do our best. I also want to call out that there is a large population who are vulnerable, and in the third wave, we want to make sure that children who are currently, not being prioritized in the program, we have to begin to start planning. And I'm very happy that the approval for a phase 3 trial on children has also been given, so that in the next few months we can understand the efficacy and the safety of the vaccination for children as well. But I believe that the country is now almost getting on the path towards an effective vaccination program.
So if I can just press further for some specifics on behalf of Apollo, what is the kind of visibility of doses? Because right now the interface for Indians is the CoWIN portal, which in most cases is a matter of chance if you get a vaccination or not. It sometimes becomes extremely complicated and difficult to get any kind of a booking and then to get a dose at all. Is this all coming because of lack of supply, or is the interface just very difficult? Is supply expected to go up significantly, at least for Apollo?
No, so supply is definitely going up, and from Monday you will see that we will be ramping up all locations. At Apollo, we have visibility in terms of tying up over the next 2 months. We're expecting about 5 million doses. We will be steadily ramping up to be giving about 1 to 1.2 lakh doses per day across our locations, as well as in large centers and in CVCs. But I want to make one very important point about the CoWIN app itself. It is important for all of us to ensure that the CoWIN app is used and all data is collated at a single point. Otherwise, how will you have a visibility on what is happening across the country? And this is a population analysis which we have to keep on doing. So CoWIN is a good app. I think that now they are opening up. There is the CVC, or the Corporate Vaccination Center. So the workplaces as well as the RWAs can also get a separate registration. That registration will not be in the public domain, and therefore the slots won't get taken up quickly. So groups of people can begin to take care of their particular, environment or their people. And as a hospital, we have tied up with many corporates and many RWAs, and we are continuing to do so. So we will be giving the vaccination to many of them. Like I said, we're working to ramp up in the current phase because of the supply to about over 1 lakh of doses per day. I think this gives you a lot of hope and a lot
over
of
1 lakh of doses. Yes.
Is what we're going to try to ramp up. We
over 1 lakh of doses per day.
No, we will start at about 20, 30,000 on Monday, Tuesday, and steadily keep ramping this up.
Okay, so give me an idea, since you spoke about the private sector, because in the beginning of this year, and this is beyond just what Apollo is doing. At the beginning of this year, we had seen all the big companies largely saying that they were committed to vaccinating their employees and their families, and one took heart in that, because that meant that the burden was taken off the state to vaccinate at least that proportion of people. Are they making any headway? Because once again, these companies are now competing for vaccinations from that 50% quota, where they're competing with hospital chains, they're competing with state governments. Are they able to make any headway?
So corporates are making significant headway. There are corporates who have got their own allocation and coming to us to administer. There are corporates who are tying up with us and saying, please administer for us in the workplace. Most corporates are also covering their employees and family members. Some corporates are even going out to say that we will also do the communities around us. Many corporates are looking at part of their supply chain. So if they're truckers, FMCG companies are saying they're truckers, they're dealers. So I'm seeing corporate India just open up with a large heart and commit to vaccinate as many people as possible. If the supply continues to open up in June and July, my expectation is that by August, we will be of 5 crore people getting vaccinated per day, and we will be well on the road to a very effective fight, a long-term decisive fight against this COVID-19.
Just one last question, ma'am. You spoke earlier about the third wave. You spoke about ramping up facilities to take care of children and vaccinations as well. How real are these concerns about the third wave and children being more vulnerable during the third wave?
So I think, Tamanna, what happened to us in the second wave is something that we should never ever see happen to us again. And that is that we were caught off guard. So I believe that every estimate, every indicator of a change in the dynamic, every possible monitoring system, whether it's, continuous testing, tracing, tracking, scaling up, we need to remain on the alert and on guard till 100% of the world is vaccinated. And therefore, I would not discount any fear, but we should tackle fear with science, with logic, with numbers, and with effective action. And therefore, we continue to hope and we continue to advocate and to plan and work towards, number one, a continuous monitoring, a continuous ramping up of the testing so that people are being watched, continuous communication so that public remains safe. Whether it's, the wearing of the mask, which has been proven time and time again as the single most effective way of protecting yourself, or to ensure that we don't have any vaccine hesitancy. As we know, when vaccines opened up on January 16th, there was a huge rush and then things slowed down. So we must ensure that we keep pushing the vaccination program till 80 to 90% of the applicable eligible population are covered. And that's a significant target. So I would not discount any fear, but not be paralyzed by fear, but use fear to give a highlight into what should be analyzed, how we should take more effective action, and always be prepared, because every life is precious.
Yeah, absolutely. Thank you so much, Dr. Reddy, for sitting down with us and taking out the time to tell us your views while India is at a very, very significant juncture. We have, I think, a glimmer of hope that over the next few weeks, at least the current condition should really ease off. And we also know that we can't make the same mistake we made after the first wave to let go completely. So it's going to be a complicated time going ahead. And of course, we'll keep an eye on all of those factors. Thank you once again, Dr. Reddy, for joining us today.
Thank you and namaste.